The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hello, everyone, and welcome to Local Update. I'm Debra Hutchison in the Rogers TV studio. Joining us this week is Robert Howard. He is Chief Possibility Officer for the United Way of Durham Region, a frequent guest on our show. Always lots to talk about. Welcome back.
Well, thank you very much, Deborah. It's great to be back, and it's great to talk to you again.
So we talked about a month ago, and at that time, you were just beginning to receive submissions for round 2 emergency community support funding. This is funding that has been given by the federal government and that you have been entrusted to take a look within our community and decide who gets a piece of this pie and how much. Let's go over once again the specific target of who this funding is supposed to help, and what were the criteria when you were looking at the submissions?
That's a great topic, Deborah, and I really appreciate you getting into it. I think if I could just take 20 seconds, I would say that I think the federal government has done a wonderful job, and it's not a partisan issue. It's got nothing to do with partisanship. It's got to do with, there's no question that COVID and the pandemic started as a medical issue, has become an economic issue, a social issue, and there was money distributed across the country. And if I do say so myself, I think the United Way movement across the country, along with the Red Cross and the community foundations, have done a wonderful job putting it to good work very effectively and very efficiently. The criteria right from the get-go was that the money would be directed to relieve the harshest impacts of the virus and on the most vulnerable in the community. And I think it was a wonderful objective, and I'm pretty certain that any government would have done it. That when you saw what happened in March and April, and I think we both know and we both have seen what has happened in the ensuing months and the perception that this would be over reasonably quickly and reasonably easily, et cetera, and the lining up at food banks, the difficulty that seniors have had, et cetera. And our priority was most vulnerable and the harshest impacts of the virus. And in round 1 of the ECSF, and I think it was about $1.5 million, I'm not, it might be 1.56 or something that was actually in Durham. And this round is 650,000, I think, give or take, in Durham. And it's a wonderful number, and we've been able to put it to use. And it has been used, and we found agencies and programs in the community that we didn't know about, that have some of whom have sprung up organically, and we've been able to put the money to use. And we're not quite through with the decision making on the ECSF round 2. I think those decisions are going to be done by the end of November. The priority for us has been seniors. The priority for us has included racialized and marginalized communities, and we've been able to direct funding in those areas. And also, the breadth and the scope of the pandemic and the impact that it has had on people's lives is not always readily apparent, and quite frankly, you and I both know, it's not going to be apparent perhaps for months, maybe even years. We don't know the entire impact of this thing from a mental health standpoint, from a longer term standpoint in terms of education gaps that are going to occur in kids, from the standpoint of some consequences. We had, at the very early stages of this thing, I got an email from a woman who, and one of the things we can talk about later on in terms of 211, we got a call from a woman. I got a call just because our office was shut down, and on our website, somehow somebody made the mistake of putting my cell phone on it. And that has a downside, has an upside, because she phoned me. Mm-hmm. And I spoke to this woman, and, I got to realize that as much as the language is that we are all in this together. You and I both know, and many people in the community also know, we're not all in this equally. And she had not eaten for a couple of days. And it was not easily and readily apparent to her how to get out. She had been an infrequent user at the food bank. She had had friends who would deliver her meals. And all of a sudden, there had to be an asymmetric process designed, and she was just going to be the tip of the iceberg, the very tip of the beginnings of the waves of the tsunami. And long story short, a couple of our agencies and programs working together, and I think that's one of the things that we were able to do with the ECSF funding, is find synergies in agencies that are cooperating with each other to prevent overlap and to prevent duplication of service, and get, in this one instance, a woman who was pretty damn frightened and didn't know what the heck where she was going. She had a spouse who predeceased her. Her children did not live in the neighborhood. And if you want to talk about the definition of loneliness and isolation and fear, it was right on the end of my cell phone. And we were able to do something. And it's an example of the kind of things and the kind of relief that was able to be provided for by the ECSF.
Was this woman a senior?
Absolutely, yes. Yep, 80 some odd years of age. Yep, this is the phone. That's the phone. And you know, I mean, my title. My title is Chief Possibility Officer, and a lot of people ask me where the heck that came from. And they think, oh, it's an United Way buzzword. You know a little bit of the story about my grandchild. And manufacturing possibility in people's life, to us and to me, I take very personally. It's not an issue of a bumper sticker. It's not an issue of a charitable slogan. It's an issue of taking the seemingly undaunting and making it possible. And there actually is a physiological difference that takes place in the mind. And if someone is diagnosed, this is going to get personal, and it shouldn't get personal. But it's okay. When someone's diagnosed with an existential illness, your viewers, the people in Durham, we all have been touched by that. Parent, maybe, a child. Yeah. They always say a parent should never bury a child, and a grandparent should never bury a grandchild. And you get faced with an existential illness. And that can be debilitating. And that debilitation, you need an inoculation against that debilitation. An inoculation against that debilitation in an issue of pediatric cancer, perhaps, is a possibility. Let's stop talking about the statistics and the data and all the rest of it, and let's talk about where we're going. What's the next step? And that became my title, and that's where I don't want to get any more personal than that. That's a possibility. And what we're doing with ECSF money, with donor money in Durham region, with the support of partners like the region of Durham, like General Motors, like Rogers, like Debra Hutchison, is create an organic structure in Durham region that says, we're going to create and manufacture possibility in people's lives. And whether it's an existential illness, well looked after. You know, Sick Kids Hospital, in my opinion, does a wonderful job. Hundreds of millions, if not billions of dollars in therapeutics and chemotherapy, great minds. Okay, we have to bring the same energy to removing the hopelessness from an 80-year-old woman who is afraid to go out and get a meal, or from a single mother who is afraid when she puts her head on the pillow at night that her kid might not be able to eat by the end of the week, or is falling behind in school, either because of distance learning and the inadequacy of the digital divide, etc. We as a team possibility. I just put you on team possibility, Debra.
I'm there. You know I'm there.
We as a team have to say, we've got to do everything we possibly can to create possibility in people's lives who are in very hopeless circumstances. And you and I both know also, there are people in those circumstances who it may not be readily apparent. That, you look at the outside and you see two cars in the garage, in the driveway, and you see a house in Whitby, or you see a house in Brooklyn or Clarington or Ajax or what have you, and you say everything's fine. Well, behind that door, there may be some family violence. Behind that door, there may be the beginning of a substance issue, exacerbated by the pandemic. There may be a job loss which creates financial pressures, which lead to substance issues, which all of a sudden lead to family violence. And you need a shelter, and you need a counseling program. And some of that stuff is not top of people's mind. Some of that stuff is not sexy. But I can tell you very frankly that some of the agency programs that we support, whether it's a substance counseling program or an anger management program at, say, John Howard, or it's the ability to provide employment counseling through Cornerstone, or it's a kid who's getting academic assistance at Simcoe, or it's somebody who's getting mentorship through Big Brothers and Big Sisters. All of that is contributing to a broad-based organic structure that says, we're going to try and not leave anybody behind in this community. We're going to do everything we can. Can we solve everybody's problems in the world? No, no way in the world. But can we afford not to try? No way in the world as well. So let's do something.
You're no stranger to desperation. You see it in people every day. That's why you are the chief possibility officer, to bring them out of that desperation. Just with COVID, though, you must be inundated, and you're seeing the numbers increase in those who are trying to find the blue sky, who are trying to find the silver lining. But they were near desperation before, but with COVID, it's pushed many over the edge.
Yeah, there's no doubt about that, Deborah. You and I both know it. And yeah, I mean, it's important, and that's why we're grateful for the ECSF funding. And I think United Way has done a wonderful job with pushing that money out into the community. And $650,000 in ECSF round 2 is a great number. And quite frankly, if we had $1.5 million or $2 million, we could still put it to good use. That's why our donors are so important. Because what our donors will enable us to do, and the contributors to the United Way Durham COVID Relief and Recovery Fund, will enable us to continue that work. Will enable us to continue the asymmetric supply lines, helping to get food to seniors. Will continue to get and stabilize the agencies who currently are providing services. One of the trigger points for people who come out of substance issues is isolation and loneliness. Mm-hmm. So from a public policy standpoint, if our government, very rightfully so, says, something, we have to do something about curbing the spread of the virus if we're going to do something about restoring our economy. And there are great minds, far more erudite, articulate, and superior to mine, who will make those decisions. And if that's the decision, we all know the consequences, including the public health officers. They know the consequences. And we're going to be there as a partner with our donors and with Team Possibility that says we'll deal with what we have to deal with.
Okay, I'm going to stop you there. We have to go to a quick break. More of our conversation with Robert Howard from the United Way of Durham Region after this.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
When you're online, Rogers TV on YouTube shares news and events from your community. Like messages from local leaders, updates on the latest health news, local business presenting their new offerings, and how our local communities are working their way through these unprecedented times. Visit and subscribe to Rogers TV on YouTube for the latest local information.
And we are back on Local Update. Debra Hutchison here in the Rogers TV studio. Our guest this week is Robert Howard. He is Chief Possibility Officer with the United Way of Durham Region. And, we've been discussing the effect of COVID on our community and how the United Way of Durham Region continues to help those and the most vulnerable. In the first part of our interview, Bob, you talked about 211 and the importance of that service. So it's a system navigation hotline. How is the United Way of Durham Region involved? At the beginning, I always thought 211 was just for Toronto, but it's for Durham Region too.
It's actually now it's all across the country.
Yeah.
The United Way, just a little bit of history, 20 seconds of history. The United Way movement beginning, and I'm embarrassed to say I don't know if it's 10, 15, or 12 years, or it might be 20 years. My instinct is it's something like 15 years. Did the very heavy lifting with the CRTC and the federal government and got approval for, in my opinion, a tremendously insightful and prescient thought, which is that you have an information and system navigation tool called 211, and that it is for non-medical emergencies, non-police emergencies, and it's very important that people remember that. But 211 allows people, whether you're living in Whitby or in Milton or in Barrie or now across the country with the input of money from the federal government, to access services which are funded in our instance, in many cases in Durham, by the United Way of Durham Region with our government partners and with our donors. You can have food banks, you can have after-school counseling programs, you can have substance counseling programs, but if people don't know how to access them, they're going to be less optimally used. And our commitment to the donor is that their dollars will contribute in a meaningful, impactful, sustainable way. And a piece of that organic wraparound service puzzle is 211. And I would say one service, anybody who's listening to this program, Deborah, and you yourself, I know you have, a popular circle, you have social media, et cetera. I would say to anybody, if you can spread the word in Durham Region that if people need and have questions about access of availability of services, whether it's COVID related or not, and it's not a medical emergency, not a police emergency, please call 211. And it was stood up. We had 2 staff in our United Way in Durham who were seconded to 211 at the very early stages of this thing, and it gave us an opportunity to see firsthand, and for them to see firsthand its real value. And they're doing a great job. And the woman that I was speaking to about earlier accessed 211 after our connectedness. And I've gotten a call back from her subsequently, and it's working for her, whether it's counseling, whether it's access to seniors' visits and outreach from organizations like Community Care. It works. It's a tremendous tool. And very early on, in the spring, just before the spring when this thing started, I think they shut down everything around March 17th, which is ironic because it was St. Patrick's Day. Yeah. And the CEO of our organization happened to be in a bar at the time, but I won't mention her name and I won't mention the bar. But that's how I remember the date. It's March 17th. She also knows that it's a very special date. And within 2 weeks, a real value in the piece of 211 is it provides us also with information and data. And data is not a bad friend to have at your side as you make policy decisions. And within 2 weeks, there was just 1 week of time, very early on, and it was the week of April the 1st to April the 8th. And I went in and they have a dashboard which we have access to. And I noticed that there were 2,700 people who had made food bank related calls. And 211 produces tremendous data in terms of whether the call is related to violence or, a landlord issue or a housing security issue or a food security issue or what have you. So in this 2 week period, and they record the nature of the call. And then they also have at the other end of the equation satisfaction, and I think the call satisfaction is something in the vicinity of 97%.
Oh, that's unheard of.
Yeah, correct. They do a wonderful job. And the week of April 1st to April the 8th, there were 2,700 calls for food bank usage in Durham region. And you'd say, okay, that's an interesting piece of data. Somebody might say, well, that's a little bit light. I would have thought only 2,700 people, third and fourth week after the beginnings of the shutdown. We hadn't reopened the schools. We knew we were heading into trouble. And there's 2,700 people making a food bank inquiry. Yes, but think about that. That's 2,700 people who are phoning 211 to find out where the food bank was, maybe what the hours were, what the criteria is, et cetera, et cetera. So those are new food bank calls. So
yeah, that's not someone that's used it before. These are new people reaching out.
Correct. That's exactly correct. So in 1 week, you're 2,700 people,
yeah.
Which if you do the arithmetic is something in the vicinity of 300, 350. I mean, my brain is, long ago lost its capacity to do that, but it's somewhere in the vicinity of 350 or so people per day who for the first time were thinking about food security issues. Mm-hmm. And that was at the beginning of this thing. And that was with regard to food precarity. So there's no question that, food precarity is an issue, but on the broader subject of 211, what it enables us to do is not only allow part of that wraparound that says to people, here's some services, but here's access to the service, and you can't always take for granted that, oh, everybody knows. They know that. Well, no, they don't know that. Sometimes you need to have a number that says 211, push it, tell the person the nature of your problem. They speak in, I think, in you can get service in something like in excess of 100 languages. It operates 24/7, and it's an important piece of the puzzle. And one thing, if anybody walks away from this show and says, I heard about this 211, and they have a neighbor. There was a woman who spoke to us very early on in this equation, and she was talking about accessing PPE and personal hand sanitizer, et cetera, et cetera. And there was all kinds of talk all over the place with episodic and piecemeal kind of not helpful organic solutions, but not necessarily scalable. And she says, Robert, nobody's got, I don't know how to access it. I said, call 211, see if you can access it. And if you can't, call me back. Mm-hmm. She called me back, and she said, Robert, I don't need you because I was prepared to go and get some because we had been given some hand sanitizer by Canadian Tire. And Canadian Tire stepped up. There were a number of companies all across the country who stepped up at the beginnings of this thing and continue to. And they had given us some hand sanitizer. I was, honestly and truthfully, they get mad at me because I was going to put some in my car and drive it over. I didn't have to do that because she phoned 211 and somebody got her some hand sanitizer and PPE. And again, she was in her 80s, living with a husband who was immune compromised because he had had surgery, et cetera, et cetera. And these are not people who live on the economic margins. They're simply people who, at the beginnings of this pandemic, and I'm absolutely certain throughout it, are saying, we've got a difficulty. And there's got to be some way to assist. And that's our role. That's my role, Deborah. That's your role. That's everybody who's on Team Possibility. And an important piece of that entire puzzle is 211.
Okay, we've only got about 5 minutes left. So I also want to talk about, of course, Christmas is coming, where want is felt more deeply. And it's pretty clear we're not going to move out into a green zone for Christmas. One of your unique ideas to help,
yep.
And it's actually a really great gift idea if you're thinking out of the box for the holiday season, is your Meals and Trees initiative. Tell us what that is all about.
Bingo, Deborah. You're absolutely correct. Internally, we referred to it as Gifts Which Give. And then we decided Gifts Which Give actually is not a bad theme. And when we roll this thing out, let's talk about Gifts Which Give. And you and I both know, and your audience knows, and there are many people around the world, including the Pope, who have identified the fact that we are dealing with a global pandemic, no issue, and we must all attack the global pandemic, knock it back, defeat its impacts, correct. We also have two other critical issues that face us as a global population. One of them is hunger, and one of them is sustainability and climate change. And we said, as I said earlier, we can't solve all the problems of the globe, but we can do something locally. We can set an example that says we in Durham region are going to not ignore these issues, but do what we can within our community. And that became Meals and Trees. And we thought to ourselves, what better time to inaugurate this? What better time to bring this out than at the holiday season and the season of giving and the season which celebrates caring and sharing and thoughtfulness. And it's gifts which give. And for every $20 that a person donates to the Meals and Trees campaign, our commitment is that we will plant one tree and we will serve 2 meals. We will assist in the battle against hunger in Durham region, and we will plant a tree. And we have a whole bunch of trees that in the springtime, if somebody wants to pick one up, we'll figure it out depending on the status of COVID at that time, what it looks like, and can you pick it up or will we plant it on your behalf, that kind of stuff. The other thing I would like to say about Meals and Trees is I really want to thank our friends at General Motors because we beta tested this thing with them a couple of weeks ago and it went fabulously. We were thrilled. And as soon as we talked about Meals and Trees, the people at GM who have been standing by us for a long, long time and do a great job in this community, said we're in. And we did it, and I've got 2 trees. I've got 2 trees out on my deck. I've got a grandson who comes and he checks on his trees, and those trees are going to get planted in the spring, and it's a gift that gives. And I think it's a wonderful way to teach kids that sometimes the season, and Christmas especially, is about giving, not necessarily receiving. And giving a meal and planting a tree for future generations, that tree is going to outlive us. It's going to outlive me. It's going to outlive you, Deborah. It's going to outlive maybe grandchildren, great-grandchildren, what have you. And it's going to be contributing to future generations. And,
how long does this program run for?
Say that again, Deb?
How long does this program run for?
That's a good question. That's a trick question. We haven't thought that
Open-ended?
We thought of launching. We are going to run this program for as long as I'd like to plant 1 million trees in Durham region and environs, because it's not easy to plant trees because you can't go on private land, and public land is big. I mean, it's a really complex issue, but the concept of giving gifts which give and educating future generations and seniors about the importance of something which is bigger than ourselves. And those 2 issues, sustainability and hunger, are bigger than ourselves.
Okay, I'm going to have to stop you there. Believe it or not, we are out of time. Thanks so much for joining us. Our guest has been Robert Howard, Chief Possibility Officer with the United Way of Durham Region. On behalf of all of us here at Rogers TV, thanks for watching. Stay safe, everyone.
Call the Rogers TV viewer response line, email us, or connect with us on social media.